Hi, and welcome to Every Day is a Gift, brought to you by the Citrus team of HPH Hospice. We are healing people's hearts in Citrus County, and our hometown staff and volunteers are very excited to offer this public affairs community show. Hi, and welcome back to Every Day is a Gift, brought to you by the Citrus team of HPH Hospice. I have a wonderful new guest with us today. This is Dr. Nerella. He's a cardiologist with Citrus Cardiology. Welcome.
Hi, Anne. Thanks for having me here.
And you're new to Citrus Cardiology?
Yes. I've been here for 3 months, and so far Citrus County has treated me well. I love it.
Citrus County is a beautiful place,
Yes.
I have to say. And I know we're going to talk today a little bit about diabetes and heart disease. And as people that watch the show have heard, I am a diabetic. And how can I decrease my risk of heart disease?
That's a great question to start on, Anne. Diabetes is such a growing problem, and in terms of in US we have almost 8% of patients, population is a diabetic, and and it's increasing. And these were like old statistics. Now, the important part of diabetes is equivalent to you having a heart attack, heart disease. Okay, there were studies which looked at people who had heart disease and who had diabetes themselves, and they found that the risk is equivalent of risk of dying as someone who has heart disease and no diabetes. And if you add diabetes and heart disease, the risk is much, much more. So in essence, having diabetes is like having heart disease.
How does diabetes affect the heart? What it exactly is? Can you explain that a little bit?
Right, sure. So, the last talk I gave, in the last week or so, I started my talk by saying that the problem you live with, it's like, I call it like not the spouse, but atherosclerosis, So I showed, all of us live with atherosclerosis. That is, plaque forms inside the arteries.
Right.
And that plaque can be, that's the one which will progress to become a heart attack at some point, or it can progress to something with chest pain and all. And in diabetics, there is higher instance of this atherosclerosis. Right. Okay, and so that's one aspect, and it causes higher risk of heart attacks and other problems related to heart attacks. Even a person who has a heart attack compared to non-diabetic to a diabetic has worse prognosis. Yes. And his recovery is also is impaired, diabetics compared to non-diabetics. So that is that is one way to fix the heart. And also, whenever anyone has any other heart problems with having diabetes at the background, it makes them higher risk for having complications, like having atrial fibrillation. If you have atrial fibrillation, if you have diabetes, your chance of having strokes and complications of atrial fibrillation is high.
Well, I was trained as a facilitator to help people understand the importance of choosing a healthcare surrogate and making a living well, healthcare advanced directives. And one of the things they were talking about was the statistics of CPR on somebody who had a chronic disease. And sitting at my table, I was just shocked at the statistics of surviving, when my heart stopped. And I made them repeat the statistics, and I didn't realize that. So it sounds like prevention is the key.
Absolutely.
So how do people prevent themselves? And I will tell you that in Citrus County, 10% of the population has diabetes, and I think that's underreported, to be honest with you.
Absolutely. And again, my experience in these 3 months is I've seen quite a few of diabetic patients, more than other parts of the country. You're absolutely right on that. So there are two aspects of prevention. One is primary prevention, the one you do first to prevent diabetes in itself, right? Right. Have healthy lifestyle, right? First of all of us need to know what our BMI is. Body mass indexes. We need to know that our weight is one of the important risk factors of having diabetes. Okay, so if your body mass index is greater than 25, you're at risk for developing diabetes, right? And you need to cut down on your weight, try to cut down your weight by cutting down on calories, watching your diet. There are a lot of a lot of help we can do in terms of cutting down weight by reducing calories.
And exercising.
Second, I'm coming to that. That's a great point. Second is exercise. So you not only cut down on calories, but you also burn more calories so that you maintain an ideal body weight. So these are some of the lifestyle modifications we can do, and avoidance of sugary foods, sugary drinks. That in itself is a great way of prevention.
Well, tell me about metabolic syndrome.
Metabolic syndrome is a constellation of risk factors, and So if you have someone who, like in a typical poster child, is someone who has a big belly, like the size is greater than 40 inches in males and 35 in women, who also has abnormal lipid, profile. You go to a doctor, they say, the bad cholesterol with the low good cholesterol and high bad cholesterol.
Right.
Okay. And hypertension, that is high blood pressure greater than 130 or 80. So, and there are other risk factors like liver problems that are also part of metabolic syndrome, but constellation of these risk factors in one particular person. So this person is very high risk, pinnacle of risk compared to, a person or a diabetic who does not have so many risk factors. So there's a normal person in the risk profile, you step up, there's a diabetic, and there's metabolic syndrome person. So this is the, constellation of risk. The step up risk, so to speak.
So the secret is exercising, watching what you eat.
Absolutely. For prevention, that's
For
a
prevention.
key. Yes.
And then if you are a diabetic, is it important that you have a cardiac workup?
Absolutely. So like going to the first point I made, the fact that you have diabetes means that you have heart disease. Your risk of dying is same as someone with heart disease. And diabetics is a truly multi-system disorder, multivascular, so to speak.
Yes.
It affects right from the brain to strokes, can cause carotid, the neck, the arteries that supply the brain that can get blocked and cause strokes, can cause coronary obstruction, cause heart attacks, can cause kidney problems, and can cause peripheral, the limbs, can get blocked and you can develop pain when you walk. So it's a truly multi-system disorder, so to speak. So it affects everywhere in the body.
Well, I did some diabetic education in a past job as a health educator, and I would ask people coming in what their A1C was. No one knew what A1C was. And so I think the most important thing you have to realize is you have to be your own advocate. You have to take care of yourself and ask questions. Doctors expect you to ask questions.
Absolutely.
I always say write them down and go in prepared. The A1C is 3 months of blood sugar, and it's very important that if you're a diabetic, it's under 7.
Right.
If you want to have no risk of getting diabetes, it's lower than that.
Absolutely.
6.
So it's a great point you raised. A1C, there are a few things I tell my diabetics you need to know. It's like absolutely essential you need to know. Number one is A1C. Okay, less than 7% is when you actually reduce your risk of complications.
Right.
And for a normal person, it's less than 6.
Right.
And the studies have shown that if you want to reduce it much more than 7, much less than 7, you actually are at risk of having other complications. So as long as you're less than 7, you're fine. Second is your LDL, the bad cholesterol.
Right.
If you have heart disease, it should not be, more than 70.
Right.
Okay, if you don't have heart disease, it should not be less than 100. And third is blood pressure. It should always be less than 130/80.
Well, I really appreciate you coming on. We've learned so much, and I want to have you back again.
Absolutely.
Because there's so much information to be shared.
Absolutely.
And education really is the key to everything. And we're going to go to another commercial break, and we'll be right back. Thanks so much. Thank you very much.